Hello everyone, and welcome to my presentation. This talk is designed to act as a trigger to start thinking about our role as workers being teachers. As you can see on the screen, our topic today is teacher work and health. Physical and mental health of any worker may become the determinant component of workability. It's known that there is a relationship between work and the health of education workers. Social demographic factors, lifestyle, workload, and aging play a significant role in it. The functional capacity of teachers is right related to physical and psychological problems. A teacher must develop educational content, organize supplies and resources, plan and implement educational activities and events, deliver personalized instructions to students with special needs, attend parent-teacher meetings, evaluate and document students' progress, develop homework assignments and tests, and teach. Here is the table of content. This presentation is structured as follows: physical issues and psychological ones, the suggestions to prevent them, and a conclusion where we will face some facts about Argentina. For educators, voice problems are an occupational hazard. On average, teachers are more than twice as likely as non-teachers to suffer from this disorder. The voice constitutes the essential work and communication instrument of teachers. The continued use and its forced abuse represent a significant occupational risk. Thus, hoarseness becomes a frequent illness among teachers forced to raise their voices or even shout constantly. Fact: women are more likely to suffer from it due to the smaller size. Excessive noise also has an impact on teachers. They are often at a higher than average risk of developing hearing problems during their lifetime. The effect of noise is felt on the autonomic nervous system and the endocrine system of the body. Findings concluded that noise exposure increases the systolic and diastolic blood pressure and changes to the heart rate. Over time, these symptoms can lead to more significant cardiovascular disease. Back pain. Almost everything in a primary school setting is designed for 4 to 11-year-old children, which means teachers working in these environments are more likely to suffer back pain injuries from constantly bending and working at low levels. Whereas high school teachers spend plenty of time sitting, marking, and assessing papers. They also stand in outward position while writing on boards. Prolonged standing is considered an important factor in the development of varicose veins. They are caused by increased blood pressure in the veins, particularly in the legs. Standing for more than 4 or more hours each day, or continuously standing for over an hour, has a significant and negative impact on vascular health. Finally, teachers may end up with carpal tunnel syndrome, an inflammation of the nerve in the wrist. It can occur due to repetitive motion injuries, such as writing on the board, using a computer all day long to type lesson plans, and prolonged desk work. Repeated flexion and extension of the wrist for more than 30 seconds increase twice the possibility. Tips to take care of your voice. Reduce teacher talking time by using body language, mime, gestures, and facial expressions rather than words. Try to facilitate discussions rather than lead them. Drink lots of water. Keep a water bottle handy and take sips as you move around the classroom. Last, do orofacial exercises. For noise reduction, promote a better indoor environment. A better climate with less noise and more ventilation may reduce sounds. Try grabbing students' attention from the start of the class. When students get noisy, try to remain silent until the class settles down. Clap your hands or turn off the lights as a way to get their attention. In other words, use non-vocal signals. Choose a pair of shoes that fits you as much as you can. Try a correct sitting position, placing your foot on the ground to distribute your body weight. Correct the standing position by pulling the shoulders back while your head is kept level and straight forward. Try stretching every half an hour if possible. Light exercise before and after work is also highly encouraged. Move around. Try walking around the classroom to keep blood circulating or sit for short periods of time. Maintain a healthy weight. Since carrying, put your feet up while sitting. Take a few minutes at the end of the day to rest your feet by elevating them above your heart to help alleviating pressure. Wear compression stockings, which apply consistent pressure in the legs, improving venous circulation and providing relief from pain. For carpal tunnel, keeping a neutral position of hands is a key factor in avoiding the syndrome. Make sure you take frequent breaks from writing on the board with chalk so that the wrists can have a chance to relax and relieve stress from your muscles until the next board is full of words. Do wrist stretches to relieve the pressure by extending hands up and bend them forward. Stress can arise when an individual is subjected to strong behavioral demands, which are difficult for them to carry out. The body's response to stress occurs immediately, but the organism reacts and tries to return to balance once the situation is overcome. Contributing factors are lack of resources and work-life imbalance. The burnout effect appears when professionals exceed their ability to react in an adaptive way. Its immediate consequence is presented in symptoms of exhaustion, fatigue, psychological issues, and severe losses of energy. Burnout occurs as a result of sustained stress never released. It is due to prolonged periods of intensity and excessive demands on energy, strength, and resources. Effective measures to overcome stress are control and understanding one's emotions and feelings, strengthening camaraderie to avoid feeling isolated, and positive assessment from superiors. The best idea is to create boundaries for yourself. Keep working at work, keep home at home. Stay healthy, enjoy personal time, talk to your colleagues, because they have already been there. Recognize what you do well. Leave schoolwork at school and make yourself a priority. In 2018, the so-called CETERA published the results of a national survey on health and working conditions considering a one-year period. 87% of teachers indicated they had suffered pathologies such as stress and dysphonia. 68% suffered musculoskeletal problems and 48% digestive problems related to stress. It means that 1 in 2 teachers suffer from them. If you're watching this video, it can be you or me.